So we've heard a lot today about some of the measures to address health disparities. This one in particular is addressed to women. How will you ensure that comprehensive reproductive health is part of any health reform package, which includes STDs, pregnancy, vaccinations, abortion, and contraception?
Well, obviously the issue of abortion in particular is extremely controversial in Washington as it is around the country. And what the House did in their bill was to say that once you set up these exchanges where insurance is offered, the Secretary would have the responsibility of ensuring that, just as today, people can buy coverage that does include abortion, people can buy coverage that does not include abortion, as they choose. And that would have to be the case going forward. I think there's a consensus, at least among the senators that I've been talking with, that we don't want to try to change the law as regards abortion as part of health care reform. We want to leave it where it is. And most of the health care policies issued today do cover abortion. I'm told that, at any rate, by folks who study this. Some do not, and we think there ought to be a choice available for folks. In addition, we think to the extent that there's a federal government subsidy of any kind or assistance provided, provision should be made to ensure that assistance is not used to provide abortions, which is consistent with the Hyde Amendment and current law.
Thank you, sir. Group 7, is this Patricia Morris?
Thank you. Hello, Senator. I have a short question for you. What is the cost of health care reform versus no health care reform?
Well, that's a short but a very good question. And again, we get all these experts coming in to tell us what the answer to that is. Most of them agree that the failure to enact health care reform is going to result in the cost of health care continuing to grow at the rate it has been growing. And that another 10 years of that, and the federal budget will be severely strained. State budgets will be severely strained. Family budgets will be severely strained. I think this Commonwealth study that just came out said that the average cost of a family policy nationwide today is a little over $12,000. They expect it to be about $22,000 10 years from now. That begins to be a burden on families. So that's what we're trying to head off, is that kind of a continued near double-digit increase in the cost of health care.
All right. Group 6 is next, Senator, and your question is going to be offered to you by Kathleen McVicker.
Thank you very much. Thank you, Senator, for doing this, and thanks to New Mexico First for helping you accomplish this. From Group 6, how are American health care reform plans currently being considered by Congress, making use of best practices and avoiding any pitfalls from other countries?
Well, as far as best practices goes, I mean, when you're talking about best practices in the providing of health care, I think we've been very careful not to get the government in the business of specifying what those best practices are. What we will obviously need to do is to have the various professional organizations specify what those best practices are, and then provide incentives in Medicare for folks to follow those best practices. So that's what we're trying to do in that regard. I think that's the right way to go. I think you get an awful lot of opinion all over the board as to what we ought to be learning from the experiences of other countries. And I don't know that there's any real consensus on think what we've sort of come down to is trying to take a hard look at what is the configuration of our healthcare delivery system today, where are its biggest problems, how do we fix those problems, how do we expand coverage, how do we control costs more effectively, and that's what we've come up with. This is not a reform proposal that is patterned after any other country that I'm aware of in any significant way. Maybe it should be, but it's not.